Hi, welcome back to our EverPar video channel here. I'm here with Courtney Hoffman, another certified financial planner professional and colleague. And what we want to do today is spend a little bit of time talking about a follow-up to the Senate Bill 102 campaign. Now, for a little background for people just tuning in, there are 4 public safety pensions in Oklahoma. You've got 3 for law enforcement, 1 for firefighters. And one of those in particular, the way that the law enforcement pensions are broke up, there's, think of it this way, there's a municipal pension, there's a county pension, and there's a state pension. Oversimplification, but that's basically how it works. On the municipal pension, the Oklahoma Police Pension and Retirement System, OPPRS, they went through some legislative changes a couple years back that reset the multiplier for pension formulas that will start July 1st of 2026 and going forward. So basically what they did is took the multiplier from 2.5, raised it to 3%, and the earliest opportunity someone has to take that is, again, July 1 of 2026. So after that piece went out, it was about a month ago, we started fielding questions regarding to different aspects to when people should do it, how they should do it. Here's the exception. The firefighter pension and a county pension, you could start as early as 18. If you think of the county side, you can start as a jailer or a detention officer and work your way into a deputy position from there. Firefighters can start at 18. But for the state police pension and for the municipal police pension, you need to be 21. Well, with the 20-year pension cycle, you're looking at professionals that can retire 41 years old. And if you look at that and you think, okay, even if they did a few more years, maybe extend out to mid-40s, even 50, then ultimately what we're looking at after that retirement is how do we pay for healthcare? And the reason that's so important is because, back with the creation of the Affordable Care Act, affectionately known as Obamacare, that now makes health insurance mandatory for everybody. And so, officers are looking at like, hey, I'm required to pay for this going forward. It's not cheap. I'll have a gap of 15, maybe 20 years before Medicare. How do I make that work? If you're looking at, let's use that age 50 example. If you retire at age 50 and you can't start Medicare till age 65, you're going to have a 15-year gap period that you're paying for out of pocket before that could kick in. Now, for an individual officer in Oklahoma, that could be upwards of about $10,000 a year. If you're looking at a upwards of $20,000 a year, right? Personally, I have a friend I talked to over the holiday weekend that's paying $18,000 a year for his wife and kids and himself for insurance premiums. So it's a big deal. Healthcare it's the easiest controllable cost. While it's mandatory, it's controllable and something that we can plan for. And it's something that we really need to look at. And so here, thinking about some of the questions that we have been asked over the last month or so since this campaign kicked off, wanted to dive into some of those.
Yeah, absolutely, Ken. I know we get a lot of questions over and over again, so let's just punch it right from the start. What is the $3,000 healthcare exclusion that officers ask about?
Yeah, great question. So this one has come up a few times, and it's so much so that this is frankly why we're doing this piece. Back in 2006, there was some legislation changes called the Pension Protection Act of 2006. Now, via the Health Retires Act, the IRS created a special tax exclusion for the purpose of paying for health care retirement. So what this is it's something that was actually created under the IRC, Internal Revenue Code, and it sits under 402 L as in Lincoln of that section. And what it allows is that someone that's an eligible retired public safety officer, you can exclude up to $3,000 a year from your gross income for the purpose of paying distributions for your retirement insurance. Now, where this is a little bit unique, previously I talked about the OPPRS changes, right? One of 4 public safety pensions in Oklahoma. This Pension Protection Act of 2006, this creation of this $3,000 exclusion to pay for healthcare benefits, that affects not only OPPRS members, but our other 3 public safety pensions in Oklahoma as well. In addition to every other law enforcement officer, firefighter, and public service, anybody that falls under public service pension in the United States. So this is a big thing to know, and surprisingly, not a lot of people know about it. Going back to the exclusion part, now, Courtney, you've got a really strong tech background, so I'm going to defer to you on explaining how that exclusion works and what it looks like here in just a minute. But basically, it's a reduction of your taxable income. So nothing that's life-changing on its own. That $3,000 benefit isn't a life-changing amount on its own, but it does affect and contributes to other planning decisions that you'll need to make in retirement. So a point worth noting, and this isn't a promise, it isn't a guarantee, but just a little aside, there's a lot of literature out there talking about the OP actively lobbying Congress right now to amend $3,000 amount up to $6,000. Now, if and when that happens, it's going to be, another game changer because insurance isn't getting any cheaper. So $3,000 benefit's nice, but a $6,000 exclusion, if the FOP could get that done, would be even better.
Yeah, wow. I mean, that would be great to see that change. And it sounds like this is something that affects, to your point, not just OPPRS, but really a lot of public safety workers, right?
That's right.
So when you've talked about this, what has been the recent changes that have happened kind of post-Secure Act?
Okay, Okay, so under the old legislation where the health insurance premium payment had to be taken directly out of your pension check, what's happened with the Secure Act 2.0 is now you can pay for premiums yourself and you reconcile at the end of the year when you're filing taxes. So just a lot more freedom and flexibility for the officers throughout the year. They go out and shop for their own insurance. They don't have to worry about necessarily how it's getting paid. They just know at the end of the year when they're reconciling all their taxes, then they get to go in and file for that exclusion that way. Courtney, I'd like to kind of parlay over to you again, alluding to this a little bit earlier. You've got a much stronger tax background than I do. You came from the corporate world as a CFO, before you were a certified financial planner professional. It's a good segue with your tax background on that side to translate to the personal finance side, if you will. Do you mind kind of walking us through
Sure.
how that tax exclusion works and how it's filed?
Absolutely. And I think with those changes, it's probably really causing a lot less friction for people to use this benefit now, right? So how do you actually claim it? That's the question people ask. So on your tax return, you're going to get a 1099-R with the gross distribution from your pension for that year. And you're going to get to subtract the healthcare exclusion amount, which is $3,000 right now. And that's going to go on your 1040. So it's on 1040 line B, but I'm going to walk you through kind of a quick example. So let's say for the year you had $50,000 in distributions or receipts from your pension. That's going to go on line 5A, that $50,000, because that's the full amount. And then right next to it is line 5B. And that's where you're going to reduce the number by the $3,000, and you're going to have $47,000 in this example on line 5B. So it's really important that on line 5B, the letters PSO are next to it, and that stands for Public Safety Officer. So that should be next to line 5B. Most tax software is going to prompt you to do that, and it's going to walk you through it. However, there are a fair number of preparers that will miss it if you don't bring that up and if you're having a CPA file your return. One of the important parts of this too is just to keep really good documentation. Similar to an HSA, you want to show receipts, your explanation of benefits from your providers, a copy of your 1099-R for the year. You don't have to attach that proof to your tax return, but in the event that you ever got audited, you want to be able to show receipt for the pension amounts, and then in turn the expenses that were spent that year on healthcare related expenses. You're going to probably also want to know what counts as a qualified premium. There's actually a pretty wide range of things that are going to be included. Your accident or health insurance, qualified long-term care insurance, Medicare Part B and Part D, and then it can be for you, your spouse, or your dependents. Premiums that are paid through your department's retiree plan, like an ACA marketplace policy or a spouse's group plan, if they're still working and you're covered under their plan, COBRA, Medicare, they all qualify. So it's a really good amount of things that you can use for this $3,000. Maybe you have one but not the other, so you're not going to be that limited. One thing that you do need to note is that the Medigap premiums are not covered. So you cannot use it to cover your Medigap or those supplement premiums. So with that being said, Ken, are there any common mistakes that you see when it comes to that from retirees?
I would think kind of pulling my own network of people. I mean, look, I've been around local law enforcement a long time. I've got a lot of friends that are still serving active duty law enforcement, a lot of friends that are still serving active duty in the fire department. I keep having this conversation with people because, I've been asked about this quite a few times over the last month, and it's amazing to me how many people didn't even know this existed. And I think sometimes even with us, working in this field, it's, we'll hear stuff and then we kind of file it away from later, but you don't really think you're not prompted to bring it up and start discussing it unless somebody shoots you an email or a text message saying, hey, what about this? I'm like, oh yeah, I know about this. And then that gets me thinking, like, why aren't we talking about this? So from a mistake standpoint, I think the biggest mistake is not knowing about it. So if you don't know about it and you are paying someone to file your taxes, make sure they know about this. Provide them this information. We've got a white paper coming out really soon that will list a lot of the stuff that Courtney just went over on how to file it, things of that nature. Another mistake that we see are people waiting to plan. What inevitably happens is people think, okay, well, hey, I retired last month. Can I start planning? We'd like to have a little bit better runway on that. I'd liken that to, we don't go execute search warrants by showing up at a house and then think, okay, now we got to do the op plan. We got to apply for the search warrant. We got to start getting all our facts together. when we're sitting at their front door. I mean, it's the same way with financial planning. We want a little bit of a runway to get all our facts together, do all the research, do all the homework to help that a little bit easier transition. So I think we talked a little bit earlier about how while the healthcare portion of it's required, we've got to pay for it. It's almost like car insurance. You just got to have it. But that being said, it's something that we can plan for. It's controllable within the financial plan. There are ways to shop for it. There are other planning tools that we can use to help mitigate that stuff, this being one of them. And the COBRA, that's another thing that comes up. People think, well, I'll just go on COBRA after I retire. Well, that's great, but that's going to run out after 18 months. And COBRA, anybody that's ever looked at it or gone through it, it's really expensive. So I know there's a lot of municipalities out there. I mean, I work for one of the larger ones in the state. I know a lot of the bigger municipalities out there have healthcare for retirees, but I also have noticed that change a lot over the years as well. As the healthcare costs get more and more expensive, what's happening is the people are being asked, the retirees are being asked to take on more and more of that cost. So if you're looking at $10,000 to $20,000 a year, as a decent average in Oklahoma, at least, it's probably going to cost you a lot more than that in other states. But if you're looking at paying that out of pocket in healthcare, it's important to know how to plan for it, what tools are available, and frankly, you're only going to get that if you're talking to a reputable firm out there with people that are trained in this sort of thing. Courtney, I'd like to ask you another question to kind of close this out. You're our director of financial planning, so you oversee all the financial planning that comes through the purview of EverPar. Can you walk us through an appropriate timeline on when to begin financial planning and what that process ultimately looks like?
Sure. We really recommend kind of a window of 6 to 12 months. Depending on the time of year, we really see a lot of heavy planning towards the end of the year. We a lot of times see a lot of planning at the beginning of the year. This goes into effect, I think, this year starting in August. Is that right? Or July?
July
10?
1.
Yeah. So if you're thinking about taking advantage of this new change, we're kind of behind the 8 ball already. So we really want to, jump on that if that's something that you're considering for this year. But if it's something for a future year, we would definitely say do that 6 to 12 months out. The other thing I was going to say, just for a couple of other tax and planning angles before we wrap this up, is one is go back and look at your prior tax returns. If you notice that the PSO isn't on your 1040, it's right there on the front page. That's something that you could potentially go back and amend. So if you're already retired or you're already, maybe using this exclusion or want to use this exclusion, you definitely have the opportunity to go back and maybe amend a couple of years worth of returns to take advantage of it if you didn't. And then the other thing that we see a lot when it comes to the kind of tax and planning side is the drop withdrawal. So you have that opportunity to take out of your drop account. And when you do that, that's going to be taxable in that current year. So if you're taking a large amount at one time, that could really push your current year income much higher into a potential higher tax bracket would be one ramification. Another one is going to be your IRMAA bracket. And so that kicks in kind of retroactively. They look back 2 years. So you do it now, you don't know it's going to affect anything. You get 2 years down the road and all of a sudden your Medicare premiums are going to be much higher. So those are some other things to take into consideration. That's a subset of this topic. And really it's just about coordinating planning. If you do that and it's thoughtful, again, even if you can't avoid it, you at least know it's coming. You need to be saving for that ahead of time. But when you don't plan and it's not coordinated, that's really where it just compounds the problem over time. So back to planning, it's just can't stress enough how important it is. So to close on a hopeful note here, though, to not leave us on a doom and gloom, This is really fixable when you engage early. The window is wide open before retirement. So we have lots of time to plan beforehand, but it gets really narrow really fast if you do it afterwards. So we'd love to be your partner in that. Our team is here, between Ken and his background and my planning background. You've got a great team here to help you coordinate that and get a solid plan in place. So head to our website, hit us up on LinkedIn, reach out to any of us directly, and we'd love to set up our foundation meeting with you and get the process started.
Courtney, thank you for being here. You're such a valuable asset to EverPar, and you're just a good colleague and partner here. I appreciate you constantly being willing to help with these pieces and being able to help the public safety officers out there.
Absolutely. Thanks again, Ken.